Hi. Thank you all for coming. We appreciate it, especially on such a lovely day. I'm sure it's lovely somewhere. My name is Bob Howard. I am kicking this event off, and will very briefly tell you that we intend to move through this relatively quickly, wisely limit ourselves to only 8 presenters. The good news is that we've asked all of them to take just a few moments, perhaps 5 minutes each, to share with you the results of the work that's been done over the last 18 months and frankly over the last 4 years. We started, a number of us have started working with various health departments, either within or on the boards or at the university. A number of people who are very interested in public health and the health of the public. So a number of things have happened. We created a task force. Mayor Joseph Deacon, who's here from Ravenna, pulled a group of people together. That task force started working with each of the health departments and looking at ways that we might address a situation common in our social settings these days, where we have considerably more needs than we have dollars to address them, and to look if there were ways that we might collaborate, work jointly to make the best use of the dollars that we do have and see what we could accomplish. Having said that, let me briefly go through the agenda. I am the co-chair of that task force that Mayor Vika started. Ralph Klexian is the other co-chair, and Ralph is out of town, but he would certainly be part of this presentation if he were here, and has been an enthusiastic member. We have folks who are variety of places, and each one will introduce themselves as they come up. We'll walk through this. We're going to do an overview of the process. John Hornick will do that from Kent State University. And I should say that the College of Public Health has been absolutely essential to the work that we have done across all of the various efforts. So we owe them, one, a very big thank you, and two, fond hope that they will continue to remain involved with us. It's a great learning experience, occasionally painful for the students in the college, but it's also been a real benefit to the community to have the expertise of the faculty and the students as they grow. So we're very pleased to have had that opportunity and that support. After that, we will have 4 speakers presenting an overview of the results of our community health assessment. And then we will have 2 of the health commissioners, Dwayne Porter and Jeff Neistat from Portage County and the City of Kent, respectively, speaking about next steps from the point of view of the health department. I want to talk a little bit, just for another minute or two, about the task force. We began initially looking at how we could collaborate effectively to make the best use of the resources that we have. And I think that we produced a report and we actually felt like we were getting a lot done, but in the context of how much there is to be done, we're just getting started. So we are hoping to continue the efforts of the task force. We've had several recommendations. Ralph and I took the opportunity, along with John and Josh Keela, who's been working with us from the university, to meet with each of the health commissioners and each of the board chairs. And we've had strong support from them as well, to continue and maybe refocus a little bit the efforts of the task force, and to look primarily in the direction of education and advocacy for public health throughout the county, and to push strongly in a focused and we hope effective way to make the case that using public dollars to improve the health of the community is both worth doing and can have a significant payoff in the health of the community and for all of us as individuals. So that is a direction that we hope to pursue. We do want to invite the individuals who have been part of the task force. We'll query each one and determine if they're interested in remaining or continuing. We also would like to broaden the membership to make sure that we have other sectors of the community more effectively represented. I can walk through what those might be, but I think probably that's a little more detail than we need right now. But if anyone is interested and would like to be involved, let me know or let Ralph know, and we'll be happy to consider that and to move forward in that direction. We also want to focus our efforts so that we have fewer but more effective meetings. We want to have a very clear purpose for each meeting. We don't intend to meet on a regular schedule, but on an as-needed schedule when there's something that requires our effort and to work jointly, collectively, collaboratively to see what we can do to move the ball forward. Having said that, I'll introduce John, and he's going to talk about the process, community health assessment.
Thank you very much, Bob. Appreciate the kind introduction. I am John Hornbeek, and I serve as Director of the Center for Public Policy and Health at Kent State University. And I've had the good fortune to, in a sense, jump on the task force train a little bit. I think about a year after things got going, I have to attribute some of that to Kelly Engelhardt and some of that to others who've been involved. And I've been just pleased and encouraged by the engagement that I've seen on the part of many, many people here in Portage County trying to take a look at public health issues here in the county and find ways to work together effectively with one another. I've been impressed very much with the health departments, the health department staffs, and the health department leadership with regard to the progress that I have seen in their work and collaborations with one another, in addition to the positive work they were doing before this process already got started. About almost 2 years ago now, this whole group, the task force, the health departments, and the university were fortunate enough to come together and submit a grant application to the Robert Wood Johnson Foundation. And that grant application resulted in the creation of a series of working groups that looked at different ways in which public health efforts here in the county could be improved and facilitated. And I've been involved closely in helping to facilitate some of those activities, along with multiple other people from the health department and from the university. The discussion we're going to have this evening really focuses on a community health assessment process that was the recommendation of one of the Robert Wood Johnson Foundation working groups. And that recommendation followed through on the initial work that Bob described with the task force, and it essentially was targeted towards enabling the 3 health districts in the county at the time, Ravenna, Kent, and Portage County, to come together jointly in some fashion to carry out a community health assessment process, and then following that, a community health improvement process. Both of these steps are required steps for local health departments to go through an accreditation process that's being given greater and greater priority here in the state of Ohio. But it's not just an Ohio thing. It's carried out by the Public Health Accreditation Board, and they accredit health departments nationally. Now, there's a reason why they do that. The reason is so that meetings like this can happen. I think the hope is that when public health is public health, as I look out on many people from the public and the various stakeholders that have come here today, teaming up, enabling capacities to come together to move forward positively to address health needs in a community, then good things can happen. And that's the assumption underlying the accreditation process. It's the assumption underlying the Robert Wood Johnson effort that had been undertaken here recently, and it's been the assumption underlying the community health assessment process we're talking about today. 3 purposes for our discussions this evening. One is we want to take a few moments and overview the community health assessment process we've just been through as a county, as a community. We also want to enable people to have an opportunity to dialogue about it, and also to comment, if they choose, on the report that has been issued. We have completed that report. We've got a handful of copies if people want to browse through it. I hope you have all how do I say, registered at the front table with your phone numbers and your emails. Our plan tomorrow is anybody who has an email address that's accurate on that will receive a copy of the report tomorrow. And our intent is that you all can take a look at that report, and if you've got comments, adjustments, things that you feel are important that should be different, added, subtracted, we're going to ask you to let us know. We would then consult with the partnership and make adjustments to that report as needed. To some degree, the report is a product, but I think the bigger product really is the process. The bigger product is the engagement that can happen because we've come together as a community to act on and define some of these issues. So our purposes then are to review the report, provide an opportunity for dialogue, and enable some feedback. This is the partnership. I'm not going to go through everybody's name, but I am going to leave the slide up for just a moment. We, with the help of a number of people on the Robert Wood Johnson Foundation Education Work Group, we identified a number of public health stakeholders here in Portage County and reached out to those stakeholders through the commissioners, through Chip Porter, through Jeff Neistat, through Kelly Engelhart in her capacity as the service director in the city of Ravenna. And we reached out to all of these individuals who agreed to spend about 6 months looking at existing data, looking at existing needs assessments, and bringing their expertise to the table to define a series of health needs that are significant here in Portage County. I will just comment that this group has been a fantastic group to work with. They brought multiple perspectives to the process that we've just been through as a facilitated effort. And the result, I think, is some better relationships than might have existed otherwise, and I think some better defined problems and issues that need to be dealt with here in the county. I hope you'll find that as we go through the presentation this evening. I'll also mention that we've had a handful of people from our Center for Public Policy and Health staff and the university assisting us. I see Adam Okerson in the back has played a role here. His name isn't up there. Josh Phil is helping us record this event in the back left. Dr. Baird is in the red coat here to my left. Nishikant Kamble is not with us today, but he's contributed in significant ways as one of our graduate students, and then Catherine Bland, who's another one of our graduate students that played a role. So we've had a number of people from the university trying to assist this group, essentially, in moving a process forward. So what was that process? Strangely enough, when people came together to look at a health assessment process, as we looked around, there have been several rounds of health assessments already. There was a community, a maternal and child health assessment that was done by a consortium of stakeholders here in Portage County that was led out of the county health department. Dr. Baird was critically involved with that. That document is up here. You should take a look at it. They did a fantastic job. And I think for the first time that I've seen in Portage County in any case, started to differentiate needs based on geography within the county. A lot of the existing data that are available now are available either on a county-by-county basis or on a macro, multiple county basis. And I think Dr. Baird and the leadership, Karen Town was here someplace, I know she was very centrally involved in this effort, undertook a major effort to bring together data at the county and sub-county levels in that particular assessment. There was another assessment that was just completed in final form earlier this year that we did out of the College of Public Health at the university, and that health assessment was a county-wide kind of assessment, but it was comprehensive. It was not limited to maternal and child health. And that too existed on the shelves in a sense as an effort to understand needs here in Portage County relating to health. There was a third assessment that was done by a number of the hospitals, which are now required under the Affordable Care Act to carry out community health needs assessments to maintain their nonprofit status. And a number of the hospitals in Summit County did a series of county-by-county health assessments, and that health assessment came out just last year as well. So here we were moving ahead to try to define needs as a community, and there were 3 health assessments already on the table. And so they served as the foundation for the work that was done to define needs. We essentially tried to look at those health assessments add information that was flowing out of the work groups that were undertaken as part of the Robert Wood Johnson Foundation grant. There were efforts to define what activities each of the health departments had underway. There were efforts to define what assets exist in Portage County in order to be able to reduce health risks and address health needs as they're moving forward, and other pieces of those reports from the Robert Wood Johnson Foundation were also fodder for this effort. And then finally, we did have continuing comments from the task force along the way. Dr. Baird and some others went through all of these 3 existing health assessments, and through that effort and through a solicitation of the expertise of all of those people you saw in that slide a few minutes ago, created an initial list of 155 health needs statements here in Portage County. And through a process whereby the data underlying those health needs were evaluated and determined to be either of good quality or in need of further, would benefit from greater investigation over time, went through a substantiation process. And Dr. Baird and a number of the folks on the Health Assessment Partnership created a data quality committee, and that committee created a 5-fold criteria by which quality data would be defined for purposes of the partnership's work. And all of those 155 statements were evaluated according to those criteria if there were data underlying them. A number of them were really more perception, in many cases backed by some evidence, in other cases backed by the expertise of some of the members of the CHOP partnership. So we ended up looking at 2 ways in which those 155 statements would be substantiated. In one case, where there were data underlying it, those data were evaluated according to the 5-fold criteria that the Data Quality Subcommittee produced. In another case, we asked that at least 2 members of the partnership agree that there was a need based on their experience and expertise, and that need be supplemented in some way, shape, or form by some form of evidence from an external source. Essentially, you would love a world in which every need you have in your community is fully substantiated with the highest quality data that would meet the kinds of standards that the Data Subcommittee created. Unfortunately, we don't live in that world. That world doesn't exist in Portage County now. I hazard a guess it probably doesn't exist in Ohio or most other communities around the country. There are a number of pressing needs for which adequate data are simply not available, but you don't have to be a genius to figure out if there's a need if you're living in that world. And so we did rely on the expertise of the members of the partnership with some additional evidence to substantiate some of these needs. So we started with 155. In the end of that process, after those needs where there was data were evaluated, and those needs for which there were not data were, discussed, reviewed, evidence gathered, we produced 46 defined and substantiated needs here in Portage County. 12 of those met the data quality objectives of the Data Subcommittee. 34 met the requirements of support from each of at least 2 of the members of our CHOP partnership, and also had some additional evidence to support them. Those 46 needs were then collapsed into 9 areas because they dovetailed with one another and they reinforced each other. This also allowed us to start talking about needs in a manageable number of cases. So if you look at kind of the nutshell, what came out of this effort, we have 9 areas of health needs with a fair amount of evidence of various aspects of those needs that probably should be addressed at some point in this community. We also collected some information on demographics relating to the social determinants of health. And essentially here what we're meaning is population characteristics that may affect the health of any particular individual with those characteristics. We did, building on Dr. Baird's work and the work of Karen Town and the Maternal and Child Health Consortium, create some geographically separated data within the county. And if you look at the report, there's a whole appendix that's devoted to that data. And then we also looked at capacities in Portage County to address those needs. So those are also existing in the report. I'm going to be quiet and turn the floor over to Ms. Engelhardt.
Thank you, everyone, for coming. Those of you that do not know who I am, my name is Kelly Engelhardt. I am the Director of Public Service, serve in that capacity currently for the City of Ravenna. I guess that's my main hat. I also wear the hat of Interim Health Commissioner, as we have worked the past several years to merge our health district with the Portage County Health District. I have been involved in the public health system in Portage County for 20 years. And as I stand here today, I really am excited to be able to have been part of this process and to be able to have really the first kind of comprehensive view of a community health assessment presented to Portage County and be able to expand upon that as Jim and Jeff are going to talk about. So the first part that they asked me to talk about is the social determinants of health. And we really cannot talk about those 9 categories of health need unless we understand the context in which people in Portage County live, where they come from, where they work, what behaviors they choose to live their life by, and what social contexts they're involved in. And so social determinants of health are a really important aspect of things that contribute to those health needs, and I think are things that we're going to have to look at comprehensively as well. As Ralph would say, he developed a Healthy Communities Partnership. How long ago was that, Jim? Do you remember? 2008?
I think before that.
6? Angela, do you remember?
6 or 7.
Yeah, so 2006, he really started this kind of initiative, and one of his big things was, what are the root causes, and how can we have some influence on health getting to the root cause? And that's really what kind of social determinants of health are. So they talk about the biological, social, physical, and behavioral determinants. One of the things that I looked at, another way to look at this is the conditions in which people are born, grow, live, work, and age. And these circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. When you think about these things, we think about which ones of these can we as a healthcare system actually impact. We really cannot impact biology and genetics. You are who you are because of how you were born. But we can probably look at things at a population level that can address behaviors, that can address housing, that can address our environment, that can impact our health. So poverty is one of those that is a result of, has shown increased risk for mortality, the prevalence of medical conditions, and the incidence of disease. Depression, inmate partner violence, and poor health are examples of those that can be an outcome of living in poverty. So some examples that are in the report that talk about Portage County is that 15% of our population lives in poverty. The city of Kent has the highest poverty rate. I know that's something to be proud of, Jeff. Though we often talk about how that is skewed because it does take into account a lot of the student population. It also is an opportunity and has been able to get us a community health center located in that area because of that poverty designation. One of the things that I wanted to point out was that in the city of Ravenna, 39% of the kids living in poverty are living in the city of Ravenna. So that also is probably demographically because we are the county seat and a lot of the social services are within our city. And so living close to those social services for people who live in poverty is important. Racial and ethnic composition. Again, the Center for Disease Control talks about the burden of disease being disproportionately placed on those who are minorities. We call that a health disparity. And those, when you look down at the data and it says that 8% overall are in racial and ethnic minorities in Portage County, we think, well, wow, we're predominantly Caucasian, so therefore we should not have that bad of a disproportionate health disparity in Portage County. That doesn't mean that we don't have pockets, and that we do have individuals in Portage County that are living at a disparate position because of their race or their ethnicity. They are generally in certain geographical pockets, and I think that our maternal child health data in that report really does a good example of that. Two of the big things that are really, life expectancy is decreased, and also infant mortality is huge in regards to the African American population. And we see that in those pockets in Portage County. Age is another one of those many determinants of health, and obviously we can't do anything about that. The alternative is not good. So my grandmother used to tell me, "Don't get old, Kelly," and I used to think, how do you stop that? All of us are getting older every day. So, but our children and our seniors are both at increased risk. Infants and children and seniors all have different risks depending on where they fall in the life spectrum. 21% of the population is reported to be under the age of 18 in Portage County, and 13% of the population is over the age of 65. That's according to the census data. The cities of Aurora and the city of Ravenna both have relatively high proportions of individuals over the age of 65, at 19% in Aurora and 15% in the city of Ravenna. And those populations, knowing your population in those communities is important to understanding the influences of health and what we can do to target those. Education, again, is another one. According to the Healthy People 2020, those who have higher levels of education have higher life expectancy. And so when you look down at our data, 90% of Portage County residents have a high school diploma, but only 25% of those have a college degree. So we have about 65% that fall kind of in a moderate education in Portage County. So we relatively could live sort of a long life, I guess, if you look at it that way. When you look at it in other ways, when you talk about education levels and not even being able to obtain a high school education, the city of Ravenna has a high degree of not obtaining a high school education. And I pulled that from the 18% in the city of Ravenna have not received a high school diploma. So, that is the highest of the city populations and not having a high school diploma. 48% in the city of Aurora, I don't think that this surprises any of us, have a bachelor's degree or higher. And then again, 10% of the residents in Freedom, Wyndham, Charleston, Paris, and those are kind of grouped as a cluster that came out of those reports. Healthcare access. Lack of health insurance is a significant barrier to having access to health care. Though we see that is somewhat changing, and that we think the Affordable Care Act is going to have some impact on access to health care. What we also know is that just by having an insurance card in your wallet doesn't necessarily mean that you're going to get care, especially when we're talking about preventive care. So making sure that once we get people to have insurance, actually utilizing the healthcare system is going to be a big component of that. 11% of county residents reported having no insurance in 2012, and again, we're anxious to see what those numbers will be at the next census report. And Freedom, Wyndham, Paris, that cluster again had the highest incidence of non-insured individuals. And lastly, unemployment. Populations with high unemployment rates are more likely to have issues with access to care, chronic disease, mental health, and addiction, and other needs, according to the CDC. Unemployment and having that direct relationship with not having health insurance, I think hopefully when health insurance was always directly tied to employment, because that's where you got your health insurance, hopefully with the Affordable Care Act that will help that as well, and we'll have more people that are insured. Unemployment rates 6% in Portage County of those 16 and older were unemployed in 2012. And the city of Ravenna, along with that Freedom Wyndham cluster, had the highest unemployment rates in 2012 at 15%. Again, the unemployment rate in the city of Ravenna is probably closely attributed to us being the county seat as well. So, and now I'll turn this over to Joel.
Good evening. I'm Joe Mallory, I'm Director of the Mental Health and Recovery Board. And first I'd like to say I'm glad that we're finally a part of this assessment process. Finally, mental health and addiction services are truly a public health concern. So thank you for having us. And also, as part of the Mental Health and Recovery Board, we also have to do an annual community plan for assessments. The hospitals do, and the health departments. It's actually nice if we can work together and do this as one active plan, which is good. And with mental health, we had a nice representation as well, not including myself, but also Town Hall 2, Family Community Services, Home and Professional Services, and Children's Advantage as part of this process. One of the areas of need is mental health and addiction. So basically, what it came down to is really, I think, two biggest needs, or looking at those, are literally life and death matters. Suicide being one of those, and compared to the national the rate, sounds like we're higher. Actually, for Portage County, we've averaged like 14 to 15 a year, and actually this year it is 15 again. I just checked with the coroner's office today about that. So it's still an area that some years are better than others, and unfortunately, then drug use, drug overdoses. This has also been a major problem. In fact, it's actually a growing problem. If you note down here at the bottom, it says there were 22 cases of fatal overdose in 2013, 14 from heroin. 2014, it's now 27, 18 from heroin. I think it was 2010, we were at 7. So I call that a public health problem. No? Okay. The second area is communicable diseases. And basically what came down here was really looking at two areas. One is the area of hepatitis, and in terms of new cases of hepatitis B in particular in Portage County. Some of this is related to drug use as well. So there are some overlap in some of these categories. So that's one of the areas in terms of the hepatitis. And then the second area was in terms of immunizations. And there's been a nice increase over time of increasing the rates for immunizations, but I think the goal, yes, is 90%. So we still have a ways to go. We're at 70%. So we felt this was still a goal we needed to look at. And the final area I'm covering is senior health. I don't know why they made me do the senior health. I did get my AARP card 6 years ago, so I guess that qualifies. But this is 65 and above is their definition. So it's showing that a third of that group does have more serious kinds of disabilities. So it's a group that really needs a little more attention. On the positive side, though, studies have shown that seniors that have the social supports really decrease their risk for all kinds of other ailments, including mental health and death. And we will now go to maternal and child health. Denise.
Thanks, Joel.
Sure.
I'm Denise Lucas, and I'm the nurse practitioner at Planned Parenthood here at Kent, and was delighted